Thinking your period is normal? Well, let's think again, because getting a monthly bleed doesn't always mean your hormones are happy. And that's exactly what we're going to dive into today. So come on, let's go. And welcome to the Fertility Godmother Show, where we talk about all things fertility. Hi, I'm Denise Erez, lovingly known as the Fertility Godmother, and I help couples overcome their fertility struggles so that they can get pregnant, stay pregnant, and have a healthy baby without putting their life on hold. And I do this by using natural medicine, functional nutrition, and neuroscience. And I've been blessed to help over 1,500 babies come into this world. So before we dive in, go ahead and like and subscribe to this video if you haven't already. And grab my free guide to Decoding Your Fertility and find out what's working and what's not working about your cycle so that you can get pregnant. And it will help you decode your own cycle even deeper. So let me start with a quick story. I have a client of mine, let's call her Rachel. She came in to see me and she was really frustrated because she had this sense that something was going on with her menstrual cycle. She had a 24-day cycle. She's been trying to conceive for over a year. And her doctor just looked at her and told her that everything looked good. Her period was fine and everything, her hormones looked good. All the things were fine, but she wasn't getting pregnant. So when I took a closer look at her menstrual cycle, we discovered that her cycle ranged between 24 and 26 days. She shared with me that she actually spotted 3 days before her actual period started. And she had 10 days of PMS, which is mood swings and irritability and feeling really sensitive and lots of bloating right before her cycle. And guess what? Her fertile mucus wasn't lining up with her actual ovulation. By the time she ovulated, her fertile mucus was dry. She was really dry at the time, which makes it much more challenging because our fertile mucus gives the sperm this special juice to help it swim faster and activate it. So no one ever told her that her menstrual cycle was actually inside. It's actually like a report card or a monthly progress report about her hormones and her health. You see, reproductive health is a window to our overall health. So here's the deal. Your period is a result of your full hormone cycle, not just the bleed. So when I say your fertility is actually a report card or a progress report, here's what I mean. When we pay attention to how you bleed, when you ovulate, if you're having fertile mucus and other symptoms that you're having, it can give us a lot of information. Let me share with you my flow framework so that we can get a deeper understanding of what this looks like. So F stands for the frequency. Is your cycle 24 days, 28 days, 35 days, 96 days? Regularity matters, but so does the length. The ideal length is no shorter than 26 days up until 32 days. This length actually gives the egg enough time to mature properly and not over ripen. So if you have a shorter cycle, then the egg might not be mature enough or healthy enough to become fertilized. And if your cycle is too long and you ovulate late, then the chances of the egg being overripe can increase chromosomal abnormalities. It can also be challenging. So again, this isn't for everybody, but this is the general rule. There are always outliers. And if you're having a challenge getting pregnant, or maybe even getting pregnant and having a challenge staying pregnant, we want to take a deeper look at your menstrual cycle. And it's also time to take a deeper look at your hormones and your thyroid. L is for the length of the bleed. Ideally, it's recommended to bleed about 4 days of having a nice full bleed. So not too heavy, not too light. We want to make sure that you're changing your pad. Hopefully it's an organic pad or organic tampon if you're using a tampon and not one with all those chemicals that actually make you bleed more and cause cramps and all the things. Ideally, we want to be able to change that about every 4 hours. If it's more than that, we have to make sure that there's no fibroids or polyps in the uterus. That could be a sign of that, or endometriosis. So that's one thing we want to check on. If it's less than that, then we want to build your body up because it doesn't have enough blood, we say in Chinese medicine, to actually nourish the uterus enough so that it can build that thick, yummy, juicy lining to create a cushy, warm uterine home for the baby. In Chinese medicine, the uterus is called the baby palace. So we want your baby palace to be luxurious, right? Nice and juicy, lots of good blood flow, healthy blood flow, fresh blood flow with fresh, nice lining. And your menstrual cycle can tell you that. Poor lining could be a nutrition issue, could be a hormonal issue, can also be a fibroid, endometriosis, inflammation, and those certain things. So those are some things we want to take a look at if you're bleeding really heavy or if you're not bleeding enough. But if you're having fresh colored blood for a good 4 days, even 3 days, without a lot of spotting. Now, it's normal to spot a couple hours before or maybe up to a day before, but when you're spotting 2, 3, 4, 7 days before or even after your cycle, we need to take a look and figure out what's happening so that we can correct that. And I have some good news. A lot of times that can be corrected with diet or supplements or herbs or acupuncture. There's a lot of different ways to go about it if we already ruled out that you don't have a fibroid or any polyps that need to be taken care of first. So it's always important to talk to your doctor, but really advocating for yourself to dive in deeper. And you may need to work with a holistic practitioner to really get an understanding of what's going on with your menstrual cycle. So O stands for the onset. So cycle day 1 is actually the day you start to bleed. So as I was saying about the spotting doesn't count as cycle day 1. As soon as you start to flow, that's when you start to count cycle day 1. If you start in the evening, the next day would be considered cycle day 1. So for example, if you start your cycle on a Saturday night, say 9 p.m., your cycle day 1 would actually be on that Sunday. That's how we track. Another thing is on onset. Are you having cramps? Do you get cramps before, during, or after your cycle? So minor sensations is normal. There is a lot going on in the body, but getting severe cramps is a sign that we want to get more healthy blood flow. We need to figure out what's going on because you do not need to suffer with those cramps. That is not normal, and there are so many things that you can do naturally to help you take care and have a healthy menstrual cycle. Doctors like to put you on the birth control pill, and when you're trying to conceive, it doesn't make sense. I find it really interesting that you want to have a baby and that they want to put you on the birth control pill, but that's what they do, that's what they know. But again, I want to just reinforce that we can do healthy things, changing your diet, again, supplements, herbs, acupuncture, mindfulness, all these things together really make a difference. So this is the thing. Oftentimes we'll look for that one magic cure, right? It's not always one thing. It's usually a combination of things. So sorry to disappoint you on that, because I know that things are overwhelming and we're looking for things to be simple. So it can be simple. Just break it down little by little and make sure that you're making progress. Tracking your progress is going to make a huge difference because you want to see that things are working. I was working with a client of mine just recently, and she's starting to see changes after a month of us working together, and it's so exciting because we're tracking the progress. She's feeling better, she's feeling less bloated, she didn't have pain, and she spotted less after really just 4 weeks of changing some things in her lifestyle and in her eating habits. That's pretty amazing, and you can do it too. And the W is for warnings, and that goes back to what I was saying even a little bit earlier as far as the PMS and the clotting, and if you have any headaches or migraines, low back pain before your cycle, a lot of fatigue, any of these things are some red flags that something is out of balance, something is out of whack. It is not normal. Now, not being normal doesn't mean that it's life-threatening. It just means that you don't have to continue that way, that there are things that can help you feel better and have a healthier menstrual cycle. So your cycle, your body is trying to talk to you. So the question is, are you listening? Are you listening to the cues that your body is giving you? Not just with your menstrual cycle, but in your overall health. So are you listening? Listen to your body. Trust yourself. So here's what most women do. They track ovulation. They wait for a positive pregnancy test. They assume that they're fine because their cycles seem to be regular. But if you're doing all the right things and still haven't conceived, your body might be waving some red flags and you've just been taught to ignore them. So I lovingly invite you and have a challenge for you if you choose to accept. Start tracking beyond just your first day of bleed. That's a huge first step. And I want you to start noticing how many days your cycle is, if you're having any spotting, when you get fertile mucus. Is it around the ovulation time? What is the color of your blood? What is the thickness of your blood? What is the consistency of your flow? And how do you feel emotionally and physically through each phase, because the healing starts when awareness begins. So this is exactly why I created the Decode Your Fertility guide, to help you really understand what your menstrual cycle is telling you, what you could be doing or not doing that could be helping you get pregnant. You'll get a deeper understanding of what a healthy menstrual cycle looks like, how to track without obsessing, and what all these things can mean, and some tips that you can do to help nourish your body. It's really your first step to becoming your own fertility detective. And if you want personalized support, my team and I are here for you. And you can definitely start with this free guide. It's going to help you connect with your own body again. So the next time your period comes, pause and look at your period cycle as communication. And just because you didn't get pregnant yet doesn't mean that you're not going to. It could just be delayed, and things have to be just right. And that goes for your partner too. So it's not just about you, and it's not just about your eggs. This is a great place to start. So look at it as communicating you. What is your body telling you? It's a time to tune in instead of looking out. And let it inform you of your next steps and not control your mood. Remember, you're in charge of your thoughts. You get to choose your thoughts, because your thoughts create how you feel. How you feel will create what you do, and what you do will ultimately create what you have. Sending you oceans of love. I'm Denise Erez, your fertility godmother, and I'll see you in the next video.